Thank you very much. This is definitely the graveyard slots. You're all still here though, nobody's gone home. It's great. We're not going to talk at you for very long. We'd like to have a bit of a conversation, but to start that conversation off, I'd like to introduce Renata Drinkwater, who's the Chief Executive at Self-Management UK, previously known as Expert Patient Programme, which is stuck in my head. And she's going to introduce us to some stuff around what self-management is and what people think about it. And then Anya's going to give us a bit of a personal reflection about what that means to her and her journey. And then we're going to open it up to a conversation with our people's panel to talk to them about their reflections, both of their experiences, but also of today as well, and perhaps to leave you with some reflections today that you might go away and think about before you come back tomorrow as well, because we're going to be here tomorrow and we'll be disruptive again tomorrow because we like doing that. And then we'd like to open it up to a big conversation so that you can join in with that conversation as well. Before I ask Renata to start, I do want to embarrass somebody though, because there's a gentleman here who spent 3 years at home without leaving the house, being very isolated, suffering some really chronic problems that really, really limited his life. And he's turned his life around, partly through some support on Twitter and building up those digital social networks that opened up a whole new world for him, partly through having an operation and losing 12 stone. And today he's come from the Fens, and this is the furthest he's been, and he's driven all the way here. So could we just put our hands together for Dominic? This is Dominic. I did ask his permission before I embarrassed him, but I think that's significant about what training, support, mutual support, friendship, understanding, information, advice, the right place, from the right people, have helped him to do, to really turn his life around, and he's done that with the right support. And I think there's some really powerful messages in there that we all need to think about. So having embarrassed Dominic, I'd like to ask Renata to talk us through Self-Management UK's work.
Thank you very much, Olivia, and good afternoon, ladies and gentlemen. As Olivia said, I'm the Chief Exec of Self-Management UK, which you may have known in its previous guise as the Expert Patients Programme Community Interest Company, and I'll tell you a little bit in a moment about why we made that change. We're actually the country's leading provider of self-management programs for people with long-term conditions. And in common with over 70% of our staff and volunteers, I too have many years sharp-end experience of self-management, in my case, of various autoimmune conditions. So I'm absolutely delighted to be here today to present the results, literally hot off the press, from the recent Self-Management UK survey of what people with long-term conditions really think. And please forgive me if I occasionally use the other P word, patient, here and there. I know we've had various debates about that today, but I'm going to switch between the two. So firstly, for those of you who don't know us, we're a national not-for-profit... That's it. We're a national not-for-profit organisation. We were originally hosted by the Department of Health when it decided way back in 2002 to introduce the concept of self-management to the UK. Initially, we were really a one-programme organisation. The Expert Patients Programme itself, which was a generic programme for anyone with a long-term condition. It was based on the chronic disease self-management programme that had been developed in the States at Stanford University. That carried on for a while, and then in 2007 it was decided to outsource the Expert Patients programme to a community interest company. And that was a new vehicle that had been created at the time for social enterprises. The new organisation was given a slug of grant funding from the department. It was set a series of objectives, which included a target of helping to facilitate the delivery of 100,000 expert patient programme course places by 2012. And we had our 10-year celebration, some of you might have been there, last year at Self-Care Week. And the Department of Health very kindly confirmed that we'd met all of the targets that we'd originally been set. Now, obviously, reaching that 100,000 target was a great thing, but we all felt that we could and should do more. So in that same year, we took the opportunity to set up an associated charity because we thought that would help us access additional funding to expand our work. And we also set up an advisory panel of the great and the good in self-management, but also including people with long-term conditions as well. The idea being that that panel would advise us on strategy and policy issues. And earlier this year, as we've just mentioned, we changed our trading identity to Self-Management UK to better reflect the whole range of programs that we now run. They're condition-specific, age-specific, community-specific, and we've also not just running programs for people with long-term conditions, but also for clinicians, other healthcare professionals, and students as well. With so many patients having gone through our programs at one stage or another over the years, we're now in the very privileged position of being able to convey their views to you direct. So what do they say? Well, here's what one person with long-term conditions says about self-management. She's Tracy, one of our tutors. I'll let you read it, but for me, the key part of that quote is, "I'd rather do the best I can to manage my condition and avoid unnecessary hospital or doctor's visits." So I'm particularly thrilled to see that we've got the People's Panel featuring at the conference today, and I know it includes some extremely effective and experienced self-managers. What we offered the conference was the opportunity to supplement their voices by bringing you the views of literally hundreds of people with long-term conditions. So to ensure we had the most up-to-date findings from those people, we commissioned a short survey using our self-management database. Everyone on our database has at least one long-term condition, and many have more than one. In addition, they've all been on one of our self-management programs. We got the go-ahead from the conference organisers to run the survey literally a couple of weeks ago. So we got on with the job and carried it out last week. And in that short time, we've attracted over 500 responses. So I think that really says a lot about people wanting their voices to be heard. It's important for those voices to be heard because so often people in the health service make assumptions about what we as people with long-term conditions actually want, which is often not what we actually want, but rather what they would like to give us. So let's take a look at what people said, and some of it may surprise you. Firstly, and this is on a very positive note here, people with long-term conditions are very appreciative of the doctors and nurses who try to help them. Less than 20% said that their doctor or nurse did not at least try to understand their long-term condition needs, as well as prescribing drugs or other medical intervention. Even more positively, 58% said that their doctor or nurse tried to understand all of their needs. So that sounds good. That's great. So far, so good. But, and there is a but, patients told us that they want a much greater say in how they are treated, and they want to be able to help themselves more. I'm going to spend a little bit of time on the responses to the question we asked about the 3 improvements that would really make the most difference to them. I said some of these findings are surprising, and surprisingly few people, around 16% level, were saying that they wanted additional access to their GP or out-of-hours care. That's very interesting given the political debates that have been going on recently about all of that. More is not always better in the view of our respondents. Certainly in my own experience, the less time I spend hanging around in waiting rooms, the better, because I've got plenty of other more interesting things I'd rather be doing. So slightly more, around the 24% level here, would like more understanding of their treatment. whether of their medication or knowing what to expect from their GP. A similar number would like someone to contact by phone if they need help, or to be connected to other people with long-term conditions. And that's something that we're hoping to facilitate with the online patient community that we've launched at the end of last year. And now things get really interesting. Some 38% of the patients want healthcare professionals to treat them as equals with a say in their treatment. That's nearly 2/5 who feel that their voice is not being heard effectively, and more than double the number that said that they wanted more out-of-hours care. Patients genuinely want to work in an equal partnership that recognises that they actually know a tremendous amount about their own conditions. Slightly more, this is around the 43%, want a GP who understands them, not just the medical needs, but the other needs around dealing with long-term conditions that they're living with 24/7. But by far the biggest improvement people would like to see, with over 60% saying this, is to be given the support they need so that they can manage their condition themselves. Of course, we shouldn't be surprised that this is what patients really want. After all, we're just normal people who want to get on with our lives. We just need some tools to help us do it. Now, as chief exec of a self-management organisation, as well as being a patient myself, you'd expect me to be a believer in self-management training and giving people the psychological tools to help manage their condition. But funnily enough, even I was sceptical about self-management initially, until I completed a self-management program for specific to one of my conditions. Having and using those tools has certainly made a very positive difference to my life, but please don't just believe me. As you can see on the chart, some 60% of patients who've been on a self-management course say that it's made a big difference to their lives. But, and it's a bigger but this time, the healthcare system seems reluctant to help people to help themselves. Shockingly, nearly half of our respondents said that they had had to wait over 5 years to be offered a place on a self-management course. Yes, 5 years. And that doesn't include the majority of patients who never even get offered the opportunity to go on a self-management course in the first instance. Now, as I think you'll all know, part of the NHS pledge to put patients at the heart of everything involves making sure that they're diagnosed and start treatment as soon as possible for any long-term condition. But treatment is much more than just medication and GP or hospital appointments. Access to knowledge about self-management tools should be just as much a right as access to appropriate medical or other treatments. But anyway, let's move on then to think about why you should be interested in self-management too. Self-managers in our survey reported that they use costly NHS services much less. 42% say they use accident and emergency less, of which 22% use it much less. That's over 2/5 of people saying that they use NHS services less as a result of being able to manage their condition better. And with the winter crisis looming in A&E departments across the country, that's a very telling finding. Furthermore, some 30% use their local GP surgery less following participation in the self-management programme. Now, when you think that, I think the figure is some 50% of visits, GP visits, are related to long-term conditions, that's a huge potential for saving money and freeing up overstretched budgets. So, in conclusion, most people want a say in their treatment and want help to help themselves. Most do not want a passive role, they want an active role. People report that being given support to be able to play that active role, such as self-management courses, significantly reduces their use of NHS services, ultimately should be saving the NHS a lot of money. In fact, the Department of Health itself, in a report a few years ago, estimated a potential saving of over £450 per person from patients who are self-managers, which would repay a typical cost of a course in under a year. So it seems an obvious thing to offer them, doesn't it? But most importantly, as well as ensuring that people make more appropriate and more cost-effective use of healthcare services, those that have been on a self-management programme feel a whole lot happier themselves. So potentially, we all can win if we give people help to help themselves. Finally, I'd like to say a really big thank you to the hundreds of people from our database who took part in the survey. I'd also like to thank all of you for listening to their voices today. And my challenge is, let's all work together to act on what they said. If you want to find out more, and we hope you do, please feel free to contact me direct or come and see us and the team on stand 47 at the exhibition. Thank you very much.